At 21, when I was diagnosed and told that I had Hodgkin's lymphoma, I had never felt more scared in my life. I had never felt more unsure about my future, about the next day, what the next week would bring. I had never felt more alone. My name is Mikey Schock. My pronouns are she, her. I am getting my PhD in clinical psychology with a focus on queer and trans identities, health disparities, and the psychological effects of cancer survivorship. In January 2022, I started feeling a lot of shortness of breath, a lot of coughing, couldn't go up a flight of stairs. I went to the doctor and he told me it was just allergies or asthma, kind of brushed it off, and I thought nothing else of it. About 7 or 8 months in, I had been to him multiple times and was starting to cough so hard that I would throw up. I went into him and said, I have been on the bathroom floor for a week. So I forced him to get me a chest x-ray. This was on a Friday, and he told me he'd give me a call back with the results on a Monday. And he called me within an hour and said, you need to get to the ER. They did a CT scan and found a giant mass or a tumor in the middle of my chest, collapsing my lung. I remember exactly how the room was. It was dark, it was cold, and this doctor walks in and sits down next to me, puts his hand on mine and says, we think that it's Hodgkin's lymphoma. And the moment I heard those 2 words, I broke down crying. I received 8 chemo treatments, which was every other week. Then I had about a month off and received 15 back-to-back radiation treatments. Going through chemo and radiation, I was on my own. I was my primary caretaker. I took myself to my own appointments. I took care of myself through my nausea and my pain and my fatigue. I was also a full-time student. The fatigue during radiation was unbearable. I could barely get out of bed some days. My head was so foggy that I had no idea what my name was at times. I lost all of my hair and it started coming out in clumps. My scalp was just on fire from the pain of my hair just lightly touching my hair, and it would just rip out of my scalp. So I shaved my head, and it was the most empowering and devastating thing at the same time. As a transgender woman, I hold a lot of my identity within my hair. So losing all of my hair was extremely difficult. Watching it grow back and feeling like my gender identity was invalidated by the length of my hair was miserable. But it was also empowering to see me surviving cancer and having a shaved head. Whenever I had a new provider, a new nurse, a new staff member that I was working with, I was extremely worried that I was going to be discriminated against or treated in a really poor manner. And I was really grateful and lucky that my providers were affirming. A lot of trans people do not have that experience. Now I'm about 2.5 years in remission. Everything is still looking good. The biggest hurdle for me was the 6 months to a year after treatment, the mental aspect of having to reacclimate and living with all of the mental toll that this trauma that I just experienced took. I think that currently there's not enough mental health care within the oncological system of cancer care. And I think that one of the biggest things that I want to advocate for and push for is for more mental health care as a standard practice within cancer care. We as queer and trans individuals need more affirming care providers. We need providers that are culturally competent enough to take care of us in our most vulnerable moments.
Vegan?